Welcome back to Mastering Public Health. In this episode, we explore Chapter 6: Physical Activity Behaviors, Benefits, Trends, Programs, and Policies. Physical activity is one of the most powerful tools for chronic disease prevention. Yet, over 75% of adults and adolescents in the United States do not meet recommended guidelines. Sedentary lifestyles, long commutes, environmental barriers, and cultural norms continue to limit activity for millions. To address this gap, the CDC launched the Active People, Healthy Nation initiative with a goal of helping 27 million Americans become more active by 2027. Learning objectives. By the end of this chapter, you should be able to explain key physical activity standards for adults, adolescents, and children, summarize the short-term and long-term benefits of physical activity, describe sedentary behavior and current activity patterns, identify environmental, social, and individual barriers to activity, evaluate evidence-based programs and community interventions, understand policies that support physical activity across settings. Section 1: Physical Activity Standards and Benefits. Physical activity is any bodily movement that requires energy expenditure. Exercise is a planned, structured form of physical activity. Types include aerobic, muscle strengthening, bone strengthening, balance, and flexibility activities. Guidelines for adults. The 2018 Physical Activity Guidelines for Americans recommend 150 minutes per week of moderate intensity aerobic activity, or 75 minutes of vigorous activity, plus muscle strengthening activities at least 2 days per week. Figures 6.1 and 6.2 illustrate these levels. Guidelines for children and teens. Young people need at least 60 minutes of activity every day, including muscle and bone strengthening activities 3 days per week. Benefits of physical activity. Regular movement influences 7 of the 10 most common chronic diseases. Immediate benefits include improved sleep, reduced anxiety, and lower blood pressure. Long-term benefits include better brain health and lower risk of dementia and depression, reduced cardiovascular disease, lower risk of 8 forms of cancer, weight management and improved metabolic function, stronger bones and better balance. These benefits are summarized in Figure 6.4. Section 2: Sedentary Behavior and Activity Patterns. Sedentary behavior includes low-energy activities such as sitting, screen use, or prolonged inactivity. U.S. adults spend an average of 9.5 hours per day sitting, increasing risk for mortality and chronic disease. Activity levels: inactive, no meaningful activity; insufficiently active, some activity, but below recommendations; active, meets guidelines; highly active, exceeds guidelines; historical and social patterns. Occupation: less than 20% of jobs now require moderate physical activity. Earlier decades relied more on labor-intensive work, but automation and computer-based roles have dramatically reduced energy expenditure. Figures 6.6 and 6.7 show this shift. Transportation: longer commutes and reliance on personal vehicles reduce time for walking or biking. Built environment: urban sprawl, lack of sidewalks, poor lighting, and disconnected streets create barriers. Walkable neighborhoods with parks and trail systems encourage routine activity. Individual factors: motivation, knowledge, cost, physical limitations, and time constraints limit participation. Social environment: social norms influence behavior. Social learning theory suggests people model behaviors they observe, whether active workplace cultures or sedentary peer groups. Section 3: Programs and Initiatives to Increase Activity. Technology and Programs. Technology plays a growing role in physical activity promotion. Fitness apps, wearable devices, online workout communities, and social platforms provide accountability, social support, and goal tracking. Workplace health. Workplace programs are the most common employer-supported wellness initiative. Strategies include organized walking groups, wellness competitions, incentives for participation, on-site or virtual exercise programs. Paid time for physical activity, rare but effective. Schools. School settings are essential for youth physical activity. Activity boosts academic performance, improves classroom behavior, and supports mental health. However, physical education time is often reduced due to standardized testing priorities. Shape America provides national standards for quality PE programs. Faith based organizations. Faith communities offer trusted, supportive environments for health promotion. Faith based interventions originate within the faith community. Faith based interventions are delivered in partnership but originate externally. Both can be effective. Community settings. Programs in barbershops, beauty salons, and cultural organizations help engage hard to reach communities. Exercise is medicine encourages clinicians to integrate physical activity prescriptions. Next is policies and environmental approaches. Sustainable activity requires supportive policy and community design. National policy. CDC programs promote inclusive activity. State physical activity and nutrition SPAN program. REACH program, racial and ethnic approaches to community health. Complete streets policies supporting walking, biking, and public transit. Safe routes to school, SRTS improving walkability around schools. State policy. Examples include Alaska, Ohio, and Pennsylvania, which integrate nutrition and activity into statewide strategies. North Carolina's Eat Smart, Move More initiative creates comprehensive standards across childcare, workplaces, schools, and communities. Community level policy and multi sector approaches. The Community Preventive Services Task Force (CPSTF) strongly recommends programs that enhance places for activity, such as parks, trails, and green spaces. Table 6.2. National and local initiatives. Walk Friendly Communities (WFC) recognizes cities designed for safe walking. Arlington County, Virginia is an example. Rails to Trails Conservancy converts abandoned rail lines into multi-use paths. Micromobility and bike share programs provide affordable, active transportation. YMCA active living initiatives improve built environments and local policy. Blue Zones project uses environments, social networks, and policies to support long-term active living. Summarizing everything here, the most successful physical activity promotion efforts target multiple levels simultaneously: personal, social, environmental, and policy. By building safe, supportive, and active communities, health promotion professionals help create environments where active living becomes the norm rather than the exception. This educational video is based on Introduction to Health Promotion, 2nd edition, Chapter 6 by Jennifer Childress. All rights to the original text belong to the author and publisher. Produced by Mastering Public Health.